I'm on your way.
I said good afternoon, right?
Good afternoon,
It is an
Mr. Chair.
afternoon. No more mornings for me. I would like to call the Health, Human, and Social Services Committee meeting to order after Mr. Strauss completed his conversation with Supervisor Brame.
Am I on this committee?
Lucky me.
Go over there.
Yes, you are, John.
Oh, okay.
First order of business to approve last month's committee meeting minutes. Motion made by Supervisor Simpson, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay, we're not going to follow the order on the board. We're going to go with employment and training first, please.
Great, good afternoon. Do you want us to sit up here or up there?
Your pleasure. Wherever you would like. Wherever makes you feel more important, Chris.
Good afternoon. This is our first time before this newly revised committee, so if any of the new members especially have questions about any of our programs, feel free to reach out and ask. If not today, call me or email or whatever, and we'll get you information. I have a couple of real easy items to consider. The first is a request to amend the county budget to add Trade Adjustment Act funding. This is a dislocated worker that was awarded Trade Act funds to pursue a new career, and we act as a pass-through for the federal money.
Okay, can we get a motion to get us on the board, please? Made by Supervisor Strauss, seconded by Supervisor Simpson. Any questions, or I know this is new for a lot of incoming supervisors. If you have any questions, please do not hesitate to ask. Okay? Okay, all those in favor?
Aye.
Opposed? Carried.
The next one is permission to attend a annual youth conference each spring. The trade association that we belong to, the New York State Association of Training and Employment Professionals, holds a youth conference. This spring it's in Saratoga Springs with permission for our senior counselor and our part-time youth counselor to attend the conference. It's for the cost of tuition only. Obviously they would meet the conference.
Okay. Motion made by Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion on this? All in favor?
Aye.
Opposed? Carried.
The third request is authorization for the chairman of the board to execute a 10-year lease with the New York State Department of Labor. I did send out some information regarding this. This has been in the works for over a year and a half. In the fall of 2014, the Office of General Services did a request for proposals for the office. We sublease from the Department of Labor, and the Office of General Services manages all the state leases on behalf of the agencies. The proposals were due in November of 2014. There were at least 5 proposals received. We did get to view 2 sites that were the 2 finalists based on the cost more than anything, and preferred location was identified, and that is the one that we're proposing now. The state has been working with the owner of the building since I think last January, so over a year, to execute the lease. The execution of that is imminent, and so the Department of Labor has come to us and said, now's time for us to consider the lease with the county. It is a 10-year lease. Personally, I'm really excited about the space. There's a couple of really good things programmatically that the space offers. And I guess I should identify it. It is in the handout, but it's the Travelers Building, often called Monument Square, in downtown Glens Falls. The space is certainly adequate for the office, but there's a couple of really important key components to it that I found very appealing. On the second floor, there's a really large meeting room that's available to any of the tenants in the building just by scheduling it. And we currently hold, we call them employer reviews in our office. We have 3 or 4 employers come and speak to our customers. But we can now hold regular job fairs in this large space without any additional cost, only a little bit more effort in terms of programming, but it could greatly impact the ability of our customers to secure employment. So for that reason alone, the space is really appealing. The office space works better than where we are currently, and there's on-site management. We've had a lot of issues with the landlord. Some of the supervisors know prior to the current landlords owning the building, there was a transition period where we had some significant issues with roof leaks and repairs going unattended. And there's on-site ownership, and plus we're closer to a lot of our customer base. It's right on the bus line. There's adequate parking. I don't know what questions you may have.
Supervisor McDevitt?
Yeah, is there any space available on this campus that would
Yeah.
address your needs? Is there any space available in the social services building that would potentially be available?
Yeah, we tried very hard. We really hoped that that's where we could go. And we worked very closely with Buildings and Grounds, and there just wasn't enough space. Together with the Department of Labor, we have over 10,000 square feet, and there just wasn't space that big. Even if you took out the conference rooms, our space needs are about 6,000 square feet. The largest space that they could come up with was only around 3,000. But that was really the hope, to be honest with you. In fact, we were originally supposed to be in that building back when it was constructed.
And then a second maybe observation, and is 10 years seems like a long time to me in general terms.
Yeah.
Common would be 3 years. I think anything over 3 would typically, I would define as uncommon, okay? But 10 years is a long time to tie somebody down for. Now, in terms of the terms and conditions of the lease as it relates to escalators, in terms of rental increases over time, over that 10-year period, can you know where that lies? It's not. Is it a fixed rate for 10 years?
Well, in the package that went out, there was a calculation that was conducted by the Department of Labor, and in the material that I prepared, I said estimated annual rate. There are a couple of unknowns still. One is the actual cost of the installation of the data ports, so that may change. The lease includes heat and electric, so that is estimated as well. But I can speak to the current lease that we have. They actually call it a office space permit agreement. And this lease was executed in January of 2010, and it was a fixed price. So my understanding is that it would be a fixed price without any escalators, because the Department of Labor is getting a fixed price on the space. The only thing that may change are utilities and the cost of the data installation.
So it is your understanding that the lease is fixed for 10 years?
Yeah.
That's what it looks
the other
like on
point
the
I wanted
sheet.
to make, I'm sorry.
I said, that's what it looks like in the sheet here.
Okay, oh, I'm sorry.
The other
Oh, okay, thank
The
you.
other point I wanted to make, and I think it, again, it speaks directly to the question, is members of the committee know our funding comes year to year, and we often, well, we don't know, as we sit here today, we don't know how much money we will have after July 1st. So there is, in our current lease, I would imagine there would be in any future lease an out clause, a 30-day out clause, so that if our federal funding wasn't approved, that there would be no obligation to be had. The Department of Labor certainly understands that, because our money does pass through the State Department of Labor, so they're well aware of the way the funding's approved and awarded every year.
I was almost thinking the opposite, Supervisor McDevitt. I mean, for a size space of 10,000 square feet, it benefits both parties to have longer term. I was actually going to ask if there was an option to renew for another 5 or.
Yeah,
I mean,
I know when they issued the proposal, they asked for a 10-year term with a 5-year option, but I haven't, we haven't seen any sample lease or draft lease or anything. The current occupancy agreement, was the 5-year extension. There was a prior 10-year lease before that.
Supervisor Seaver?
So it's about an increase of 15,000 a year, based on what the
In
previous
cost, yes.
resolution
Yep.
and cost. And then did the, previous lease that you have right now also include the utilities? So when I'm looking at that 42,000,
Yeah.
that did include.
It
the
doesn't
utilities.
include telephone, but it includes heat and electric.
Okay. And you said you think there is that 5-year, there'll be an out clause.
Yeah, yeah. And, you know, the authorization is for the chairman to sign it, subject to, of course, the county attorney's review. So it's really in our ballpark to be able to do those things.
Any other questions or comments? All those in favor?
Aye.
Opposed? Carried. Okay.
The other handout that I had was, back in October, Supervisor Vanslo had asked questions about the TASC and GED programs, and I included a 3-page handout. And I'm sorry I didn't have this together when the agenda went out. Just a quick snapshot of the experience with the new high school equivalency diploma. Just a couple of quick things on the first page. You see the number of exams taken and then passed by our county youth program. 2012, 22 students, youth took the test, 17 passed. 2013, it was down a little bit. That was kind of a transition year. At that point, it had been announced that the test was going to change to the TASC, and so there were a number of people that kind of backed off and didn't want to take it, and you certainly see that in 2014. The new test was rolled out in January of 2014, and quite frankly, there weren't enough testing sites, so there was a period of 5 months where there were literally no tests were offered in our region. So you see the numbers go down in 2014, and then it bounced back in 2015. So, you know, I think there was that transition period, but the experience, you know, at least in the last 4 years, has actually been okay. We actually had more youth pass the exam in 2015 as a percentage than in the more recent prior years. That's attributed to a couple of things. We do have a new teacher. We contract with BOCES for the TASC program. There is a new teacher that we just think is really great. She's really connected to the kids, and we think that's part of the reason why the passing rate went up. I then included some of the state statistics just for comparison. They had a big bump in 2013 where people rushed to take the exam. One of the differences in New York versus a lot of the other states is that there's no qualifications to sit for the exam. You can just sign up and go take it. And that's one of the reasons why the passing rate is lower than what we experience with our youth, because we send them to training first. So they get trained on the questions and the information before they sit for the exam. And we don't let them sit for the exam until we feel they're ready and we think they'll pass. So you see the difference between our experience and the statewide average. And you see the same thing, the numbers were way down in 2014. The numbers aren't available yet for 2015. And I did include the newspaper article where some of this information was taken from. I don't know if you have any questions. I know.
Yes, I
Yeah,
just
go ahead.
maybe make a commentary. I've always been, and we have a couple of educators at the table here, but I've never been able to understand why we would make the GED exam more difficult. I can well appreciate the concern for excellence and standards at a traditional high school level, but why don't we just get these folks into the system, give them a GED, which is essentially a high school equivalency, I assume, and let them figure it out from that point. But to put some hurdles in front of people that are trying to get just a fundamental high school diploma, I just think is fundamentally wrong. And I don't know if that goes to national objections as it relates to Common Core, or maybe that's part of it.
It is part of it, yeah. I mean, liar here, because we all agree with you 100%. And, I'll often tell people, we deal mostly with kids that have dropped out of high school. So if you're in high school, between the state of New York and the local taxpayers, and I don't remember the exact average, $24,000 a student. You drop out of high school, what do you get? We spend $1,200 maybe per kid to send them to BOCES to get an education so they can pass the exam. So I mean, it's quite a disparity, to go from 24,000 to 1,200. And if we had that 24,000 to work with the out-of-school youth, I mean, we could do wonders with it. And I'm not, saying anything against teachers. It's just the way the system's set up. That's why it's so designed to keep the kids in school. We won't even take them until they've been out of school for at least a year, which is another problem. Again, it's part of the rules that we have to follow. Yeah, we agree. Did you want to add anything, Sharon?
Well, I agree with you. I don't think the State Education Department would. The other issue we have is now an IEP, an individual educational plan, is not accepted as an equivalent of a high school diploma. So when someone goes to get a job and they only have an IEP, they cannot say they have a high school diploma. So those young people with disabilities, whether they're learning disabilities or behavioral issues, come to us for their task, which is their high school equivalency diploma. It never was a GED, it was always a high school equivalency diploma. And this is making it much more difficult for them. But we have seen some success, and that one year that their test wasn't offered, we were a little frightened by them.
Again, piggyback on what you just said, the motivation or intent behind maybe separating the old GED from today's GED, when it, I guess, according to what you just said, it used to be equivalent to a high school diploma and is now not viewed in that same context. What's the motivation to do that?
Well, it is viewed now still.
Oh, it is.
The task is considered a high school equivalency diploma. The IEP, which young people with disabilities have, is not
I see,
an
okay.
diploma. Used to also, the IEP used to be a credential. For our program, that's no longer recognized as a credential. It's no longer recognized as someone who's completed their high school. So it makes it much more difficult for young people who have disabilities to obtain that high school equivalency diploma. But we're trying desperately, and BOCES is as well, our local BOCES, and Warren and Washington County work very closely to try to make these young people as successful as possible, to get them back into the workforce, which is the whole purpose of our program, or into the workforce.
Anything else?
The only other thing I had is an informational item. Again, old members of the committee may recall we used to have a work crew supervisor. We would have him mentor our kids that were in the task program, and they would go around the county and do basically public work projects for nonprofits and communities. The person that we had in that position left in November, and we are now going to start looking for a replacement. It's a part-time temporary job. We're looking at it as a seasonal, get them up and running April, May, and work through the summer and into the fall till the weather gets bad. But we've had great success with that program in the past, working on public projects, parks, trails, DPW garages, painting. Did a lot of work for the Housing Authority, Salvation Army. Sharon has our youth newsletter that has a couple of articles in there about it that she passed out for you. But if you know of anyone that might be interested, have them contact me. We will publish the opening and post it for civil service. All the normal procedures and requirements.
Very good. Anything else for Chris and Sharon? Thank you, guys.
Thank you. Yeah.
Yep.
Next, we'll have Office of the Aging. I didn't see it earlier. Yeah, you always are.
And hopefully you don't have a copy of all the same things today. You wanna check? Oh, there you go.
Read all that too.
I ate most of it, yeah.
Whenever you're ready, Christine.
All right, I just have some contract requests, they're fairly straightforward. I do. There you go. The first one is resolution request number 4. It is to extend contracts under CSE, which is the Community Services for the Elderly Program. The contract, the attachments are on the back of the sheet, which outlines each individual contract.
Okay, motion made by Supervisor Simpson, second by Supervisor Bramer. Any discussion on any of these? All in favor?
Aye.
Opposed? Carried. Okay, number 2.
All right, the next one is to extend contracts under ISIP. That is the Expanded In-Home Services for the Elderly Program. It's most of our in-home care.
These are all 100%, correct?
No, these are not.
Huh?
They're 75-25.
They're 75, 25?
75 reimbursed, yep. The Hamilton County portion is paid for by Hamilton County.
Okay. Motion made by Supervisor Fraser, seconded by Supervisor McDonald. Any discussion? All in favor?
Aye.
Opposed? Carried.
The next is to extend contracts under 3E, which is the Family Caregiver Support Program. And that has a couple different, there's some in-home care in there, some case management, some Alzheimer Association Safe Return bracelets, all related to serving caregivers who are caring for the elderly.
Okay. Motion by Supervisor Bramer, seconded by Supervisor Fraser. Any discussion on this one? Yes, Supervisor Bramer.
What is triple IE, what does it stand for?
It's Title III, which is what the, most of the, Office for the Aging is funded under Title III of the federally funded programs. It's just called Title III.
Okay. All in favor?
Aye.
Opposed? Number 4.
The next one is it's a resolution request to apply for MIPA, ADRC funding. MIPA stands for Medicare, Improvement Patient Provider Act. ADRC stands for, Aging and Disability Resource Center. This funding, we apply for it annually. It's different funding amounts annually. It assists our local HICAP program, and HICAP is the Health Insurance Information Counseling Application Program. And it assists the HICAP program with outreach to MSP and LIS folks, which is the Medicare Savings Program and the Low Income Subsidy Program. I know it's a lot of acronyms, which is why
We just
usually
make
I
up
kind of whip
acronyms.
through it and I forget to tell everybody, but I know we have some new people, so I'm trying to, I have to think about it myself sometimes, what exactly it stands for. It's not a lot of money, it's $16,410, and that is 100% reimbursed.
Just make up acronyms to get grant monies, correct? Okay, motion made by Supervisor Fraser, seconded by Supervisor Simpson to get this money in our pockets. All in favor?
Aye.
Opposed? Carried. Okay.
And then I just have a couple informational items. The first one is that my office had met with the Glens Falls Hospital Healthy Community Living Program, and they had asked us if we'd be interested in adopting a policy about healthy eating guidelines when we have meetings, and so I will be adopting that policy. I want to let you guys know. It's just basically saying that when we hold meetings that we'll offer healthy alternatives to people, which we pretty much already do, but just kind of making it official.
We can't.
I need,
So.
John and I have to
Need a
exclude ourselves from
translator.
this
Doesn't
one?
apply to the supervisor.
Yeah.
If you come to one of my meetings, you'll have to eat my healthy food. And then the second one is, and this is kind of, actually this is great for my office, we're going to be collaborating with SUNY Plattsburgh. on the Caregiver Support Initiative. It's a lot of money they've gotten through the Alzheimer's organization, and they're actually gonna be placing what they're calling a care navigator, which is, somebody who's gonna assist caregivers of folks that have dementia-related diagnoses, and they'll be able to come into our office and meet with this person, who will be totally paid for by the Alzheimer's Association through SUNY Plattsburgh, and they'll offer care management and, navigation through the care system, and they have some respite hours, which is awesome, because we have a waiting list for those services. So,
Good.
just to keep you guys in the loop on that. The applications are out, so if you know anyone that might be interested in that job, it's posted.
Very good.
And that's all I have.
Excellent. Anything for Christie? Yep. Okay, thank you, Christie.
All right, thanks a lot.
Next, social services.
You know, we could go to the meetings if we had to, kind of what we do.
I know.
Right through this agenda.
No, I could've used, some Jeremy for lunch.
I thought they were gonna get us lunch when they had that short period. Ron, you better make sure you have dinner before you go to your board meeting.
That's pretty
Yeah,
cool.
well, I'm home about a half an hour. But I have a PowerPoint showing how unfair Glens Falls is being to Queens Ray.
Whoa. Oh no, I can't make it tonight.
Yeah, yeah,
I'm gonna
yeah.
try to. Forgot about that.
Very much.
Dee, we'll get started with you when you are ready.
Okay. The first item on the agenda is a resolution request, to appoint 2 members to the Warren County Youth Board for 2016. I'm not sure, originally we thought the first person was, not a reappointment, but she actually is. It's Lori O'Shaughnessy from the Queensberry Park and Rec. I believe that Joanne did end up finding the resolution and indicating the, date on your agenda forms that are copied here. The second member is Michael Cherubini, and he is a new appointment from the town of Hague.
Okay, get a motion to get these on the floor, please. Made by Supervisor McDevitt, seconded by Supervisor Frazier. Okay, any questions or discussion on this item? Not all in favor? Opposed, carried. Okay.
So the second agenda item, and actually the last for me, shockingly today, is a request that I have to increase the salary from $67,052 to $70,000 a year for my first assistant DFS attorney to match that of the assistant county attorney position that I believe the posting has just closed for. There are several reasons for this. When it came to my attention that the position announcement for the assistant county attorney was listed at that with a minimum of 2 years experience, I did a cost-benefit analysis in my head, which took about 10 seconds, and obviously my attorney that I've been working with for the past 18 months is highly qualified. She is making less than that currently, and she has nearly 5 years of experience in addition to the bar admission. I can't adequately express what her dedication has been to the department and to that position for the past 18 months. She has committed nights and weekends, as I have expressed before, and consistently takes off-hour calls from our caseworkers for the child protective matters. She's shown herself to be definitely worthy of the equality as far as the salary for that assistant county attorney position. And frankly, I don't want to lose her for that amount of money. I believe that that position has closed. There are applicants for that. I'm willing to fight for her for that $3,000 and get her up to that level. I did review the county salary schedule and the budget for 2016, There are different departments, obviously, the district attorney's office, the public defender's office, the county attorney's office, and our office, where there are attorneys. I will note that the first assistant public defender is over that amount as well. So, there are quite a range of salaries in there. I believe that, all the attorneys in the county work extremely hard, and I'm willing to fight for my attorney so that I can keep her. It would be a huge loss to our department, to lose her, especially, while it would be good if she did go to another department, it would be a great loss for us. In my opinion, Child Protective work is the most important work that we have here. She's done an excellent job under very trying conditions. As we all know, the past 18 months, we started out with a wonderful Judge Breen. His sudden passing after us being there only a couple of months was very hard for us. We had to work with some rotating judges. Once she finally perfected her craft in that rotation, now we have a new family court judge, which is a whole new ballgame for us. And even though we were successful in getting the full-time position, we did take over the half-time duties, I guess, that Attorney Bartlett had been doing for us for so long, in addition to some more right now because of the lack of staff in their office. So we are still constantly working around the clock. We were all there until at least 6:30 on Friday, working through some interesting things that were going on. She's just a great asset to our department, and I would really hate to lose her for that. I do want to say that this committee has been very kind to us. You've understood my arguments, and I do feel like this is an important one to make. Because of the relatively small nature of the increase, I did have a chance to go over it as far as our budget with Julie Montero. It would be roughly a total annual increase, including FICA, of a little over $3,000, given that we get more than 2/3 reimbursement on those salaries. For the rest of the year, it would be an increase of roughly below $900, around $860 to $880 for the rest of the year. And that would come fully out of the DSS budget already. As you know, we do have some positions that are vacant right now we're not paying salary on, so we could definitely include that, and then we could go from there for next year's budget. I certainly think that she was worthy of this last year. I wasn't too involved in the budget discussions, especially as far as salaries go, but I think now is the time I have to ask for it. I certainly would not want to lose her for that small amount of money.
Very well said. Can we get a motion to get this on the floor for discussion? Made by Supervisor Devitt, second by Supervisor Brammer. Any questions, or Supervisor Siebert?
I just have two questions. One, was this position presented during the budget request for going into this year? And if it was, I'm just wondering, I know Frank isn't here, but if was it requested?
I cannot say whether it was requested during committee because I was not present during those meetings. This literally came up to me last week. I, again, was not involved really in any kind of budget discussions with the commissioner last year, so I don't believe that any special request was made. I don't believe that the vacancy was even known for Attorney Bartlett's departure until after the budget year was already completed, probably in the beginning of this year. And certainly nobody knew what the salary was going to be proposed as. So this is all.
Well, and part two of my question is just, you keep saying you don't want to lose her, and am I missing something? Did she apply for the position then in the county attorney's office? And she's saying
That's
she's
correct.
interested in taking that, so you're here in front of us saying, make the salary equal so I can keep her in what she's doing, and she's expressed a desire to want to stay
Yes.
doing the work. This isn't an issue of the work, it's an issue of the salary.
Not necessarily, no. Yes, it's a major issue of the salary, and, whether or not somebody's willing to fight for a highly intelligent, highly dedicated person, and I am, so that's why I'm here today.
Supervisor Brammer?
Did she get a raise last year?
I believe she did get a raise, 2%. I have the salary schedule actually. 2.5%. I can tell you exactly what it was. Last year, it was $65,417. this year, $67,052. I probably would have advocated for higher than 2.5% if I had been involved, but, as I said, I was not. I feel like now is an appropriate time to ask, and, I can also say one last thing, that, when you were kind enough to approve the full-time position for us, we had one applicant, and we hired that person, and there may not be any more if we lose her. And for me to take on a fourth position, which is prosecuting child abuse and neglect petitions and family court, amongst everything else that she does, I'm not sure that that's gonna work. So I think that, the cost benefit is definitely there to try to keep her.
Paul, can you add anything to this, or is it, I mean, I'm sure she passes.
Yeah,
By
I met with Cynthia and looked at the situation as well, and you know, when you try to set these salaries, you do the best you can. There's always, it's never a precise number. Salaries are always a range, and salaries always depend upon the given facts at the time. And over the years, we've done enough of these reviews, or I have, and I know Joanne has as well, to know that, I mean, being off by $3,000 that's very possible. And given the fact that the county attorney's office is looking to hire an assistant at 70, and that's the authorization that's been provided, I can certainly understand why this salary needs to come to 70. I mean, you have to have equity between the positions within the county, and that's one of the things we do try to do. Is on not only attorneys, but on every level, we always look at what the rest of the county's getting. That's not to say that we try to bring people up to the highest number, but we try to always find equity amongst the salaries. And to me, you know, $3,000 one way or another is certainly within reason.
Okay, we do have a motion on the floor and a second. Any other discussion on this item? Okay, all in favor?
Aye.
Opposed? Carried. Okay.
I just have a quick question, Mr. Chairman. Cynthia, you mentioned at the last meeting that your department had inherited some additional legal responsibilities, I think specifically in the area of, was it juvenile law?
Yes, both child support and...
Can you maybe let us know why you have assumed those responsibilities, and is that an important area? Is it going to be a time-consuming addition to your responsibilities?
I believe that if we continue to keep those, and again, you know, we're not really sure, given the departure of the Assistant County Attorney Bartlett, but her coming back in part-time, we're going to have ongoing discussions with her and the new county attorney as far as how those roles are going to be divided. According to Attorney Bartlett, and she can maybe answer this more precisely, but at one point, either when our offices were combined or even when we split off, our department did handle some of those cases. And this is after the initial presentment of, we're talking about juvenile delinquency and person in need of supervision cases in family court. But we have already, my two attorneys have already appeared in court on both of those types of matters. And it's typically when the children are remanded to our care and custody that we're going to be taking over.
Is there any reason, and maybe Amy, you can help me with this, why those responsibilities, which are apparently moving from the county attorney's office over to social services, why those responsibilities just do not stay full-time with the county attorney?
Well, actually,
Why move them over?
quite honestly, I think that basically what happened is that prior to the beginning of this year, my job was half special services, half county attorney. At the beginning of the year, I became full county attorney. So I was not doing any social service positions. So the positions that have been, the job duties that have been assumed have been basically child support, prosecuting child support matters, and also any kind of babies or any kind of, and when the child is in the care and custody of the DSS. That's, I still, DSS, the office still continues to do baby prosecution, continued prosecution. So that's pretty much the story. Basically, we have had a half-time position, the county attorney's office, the social services had a half-time position. We couldn't find anybody, so we combined it into one position. My understanding, and that's basically what happened.
Paul, you want to add?
Well, Amy just captured what I was going to bring up, that this was part of a thought-out transition as part of the budget process, rather than have half and half, make a full-time attorney over there, make a full-time over, and then transfer the work. So this was all part of a planned move.
I guess in further answering that, I guess we didn't realize how much more extra work that was going to be, but it is. Yeah.
Supervisor Brown?
Thank you. What, you mentioned just now a second assistant. What is that person's title and what does that person make?
That is the person that we just hired in November, Philip Perry. I can tell you exactly what it makes. We have not, since his position is fairly new and we only ever had the assistant county attorney, we hadn't delineated like the other departments had with first and second and things like that. Perhaps we should at this point. His position makes $62,500.
Supervisor Simpson?
I just had a question. You mentioned, there were some vacant positions. What departments, are they in CPS or where are the?
Accounting.
Julie's position is still open, the one that we came to the committee last time to fill. We also have, a caseworker position that is, open at this time.
Are they advertised now or gonna fill them? Or?
Yes, hopefully, soon.
I assume the caseloads are increasing. I mean, it seems like everything that's going on around us, you read the papers, it's not declining, it's increasing. And
Not at all, no, we're still right up with all the numbers that we have been. I can give you some good news though, actually, I just got news that our casework contacts are above the federal, requirement for foster care, workers, so we're still like doing wonderfully over there and everybody is working as hard as they can. Really doing great with, trying to approve overtime where we need it for safety reasons, and things like that. So, I mean, we're really, everyone's doing a wonderful job over there, not least of all my attorneys.
Okay, anything else? We moving to, D first, or Julie? Let's go with you, D.
Rock, paper, scissors? The first item that we have on our agenda is a request to change the title of our full-time labor position to a full-time food service helper position. They're both at 40 hours a week, both full-time, both a grade 2, and the same exact salary. The Civil Service Office just asked us to change it so it better reflects what the job duties describe or entail.
Motion made by Supervisor Simpson, second by Supervisor Frazier. Any discussion on this? All in favor?
Aye.
Opposed? Carried. Item 2.
The second item was added to the agenda on Friday, late afternoon. The Empire State Association of Assisted Living Conference is being offered May 1st to May 4th. It's a cost of $799. It gives me half of the continuing education credits that I need every 2 years from Department of Health.
100%
It's in
reimbursed?
Saratoga, so there's no travel.
How much reimbursed is this?
50%.
50. Okay, motion made by Supervisor McDevitt, seconded by Supervisor Stroud. All in favor?
Aye.
Opposed? Carried.
On the back of the agenda is our overtime report, and it was updated this morning to reflect our most recent pay period cycle. And we are down overall from last year, a couple hours. And the last thing I have for you is we are going to start having a open house community night once a month. It's going to be the second Friday of the month from 6 to 8 p.m., trying to get some more community involvement, advertise the facility, that kind of thing. So you guys have a flyer on the first one that we're going to have, which is going to have the St. Patrick's Day theme. So hopefully some of you can attend and anybody else that wants to.
Are you going, Supervisor Shelton?
All in green.
Very green?
All in green. Okay, anything else for D? Thank you. Julie?
Okay, for our overtime report, we're a little up from this time last year. considering we've had a caseworker out on extended medical leave, we've had a lot of new reports, we've had foster care training, which involves a couple staff have to do that training at night. So all those things have led to a little more overtime than we've had. And then for the, revenue and expenditure, this kind of wraps up the 2015. We'll still have a few expenses, but for the most part, the numbers you're looking at are going to be pretty well what we expend for 2015. And our revenue is based on our expenses, so that's gonna be down as well. But overall, it looks good. We came in under budget, which is always the goal.
Okay, very good. Any, questions or comments? Anything else for social services? Okay, thank you guys very much. Robert.
Good afternoon. Again, I'm Rob York, Director of Community Services. I have one resolution request item. I believe everyone got a copy of my handout. There's a request to approve a 3-year lease agreement for the Office of Community Services at 230 Maple Street in Glens Falls. This is a location we have had our offices at for, I don't know, probably the last 9 or 10 years. We are co-located with one of our contract agencies, the Warren Washington Association for Mental Health. There's some detail on the actual resolution request there about the amount of square footage and our monthly expense. In terms of the built-in increases over the 3 years, there is a provision in there for a 2% increase each year. And this is something we negotiated prior to the previous lease agreement. Prior to that, it had been 3% a year. We had negotiated it down to 2% a year. The location does work well for us because we cover the 2 counties, Warren and Washington, and the location on Maple Street there is a nice location for us because it's in between the 2 municipal centers, co-located with some of our providers. We have regular weekly meetings with other folks there in the building, other providers. So it works well for us.
Rob, has this already been approved by Washington County?
Yes, it has, and the dollar amount is approved in the budget, but because it's a 3-year agreement, there was a request to bring it forward for a resolution by the board.
Okay. Motion made by Supervisor Simpson, second by Supervisor McDevitt. Questions?
Let me just confirm or reinforce what Rob said. It's a great location. It gives Washington County a nice back door in terms of getting to the location. Offices are well set up, great conference room, and it's a great location.
Very good. Okay, anything else? All in favor?
Aye.
Opposed? Carried. Okay.
Second item is I put on here just an overview presentation of my office, and I know a number of you have seen this before, even fairly recently, so my apologies for some duplication, but for some of you this is new. Welcome any questions along the way, or if you want to follow up afterwards. So again, my office is a shared office between the 2 counties. It's an administrative office, and we have a presence on both of the county websites. Here is a chart that shows our current staffing. There's 6 of us. The lowest box there, Linda Wright, is our newest hire, and actually she hasn't started. She'll be starting next Monday, so that's a new position. The other positions have been in place for a number of years. We receive funding, from 3 state offices, Office of Mental Health, Office of Alcoholism and Substance Abuse Services, and the Office for People, with Developmental Disabilities. We primarily serve as a pass-through for state funding, and we develop contracts with local not-for-profit agencies, for services related to these 3 disability areas. We also have some responsibility under mental hygiene law for, planning for services and identifying, gaps in services, planning for services with our contracts. Most of the way that we're set up is dictated in mental hygiene law, Article 41. This directs local governments or counties to either provide or arrange for preventive, rehabilitative, and treatment services for the 3 disability areas. Some counties in New York State provide the services directly. In Warren and Washington counties, we arrange for services through contracts. Under mental hygiene law, Article 41 also requires the establishment by the county of a local government unit given authority under Article 41 to provide or arrange for those services. And the Office of Community Services is that local governmental unit given that authority by both Warren and Washington counties. There's an intermunicipal agreement that was developed between the 2 counties a number of years ago. It details the sharing of the one administrative office and how our costs are distributed between the counties. So for the most part, administrative costs are totaled and split evenly between the 2 counties, and there's an annual chargeback that happens at the end of each year or in the first quarter of the following year to Washington County for reimbursement of what works out to be almost equal 50% of the administrative expenses. The part that's not equal is that every county in New York State pays dues to a statewide association, and that is prorated based on population. So the dues amounts between the 2 counties are slightly different. So each county pays their own dues to the statewide association. Okay, under Article 41 also requires each local governmental unit to have a community services board. So each of the counties has their own separate community services board. These are 9-member boards. The members serve for 4-year terms, and officers are elected for 2-year terms. I have a listing here of the current composition of the Warren County Board. With 1 vacancy, we have a vacancy currently for a peer representative. We try to maintain a peer slot somewhere among the 2 boards. Some of these folks you may know or be aware of. And then I also have a slide here of the Washington County Board. The boards are, mental hygiene law requires the boards to be comprised of certain types of individuals from the community, people who have a vested interest in the 3 disability areas, parents, recipients, providers, people who have some sort of a vested interest in an experience in the areas. Okay, in terms of planning, mental hygiene law also requires us to produce an annual plan and to have a developed planning process. This is accomplished through a subcommittee structure. For the 3 disability areas, we have separate subcommittees for each of the 3 areas. Our mental health and chemical dependency subcommittees have been meeting jointly over the last couple of years because so many of the statewide initiatives involve both of those fields. But we develop and produce an annual plan every year with input from providers, parents, recipients, stakeholders, and our annual plan is submitted. We used to have to submit separate plans for the 3 disability areas to the 3 different agencies, but they finally were able to get together and produce one comprehensive plan that covers the 3 areas, and we submit that through an online portal, and it goes to all 3 agencies. just details the, subcommittees, that we're actually required to have separate subcommittees, so that's why I say that the mental health and substance abuse have been meeting jointly. They're still separate subcommittees, but they meet jointly. We also have established a separate children and youth, subcommittee, because we feel it's important to have, stakeholders around the table focused on children and youth issues, particularly as they relate to, mental health, but the subcommittee also covers, substance abuse and developmental disability issues. So again, the subcommittees, provide a venue for service system planning, implementation and coordination of local services. So we have all of our providers that we contract with, part of our contract is to participate in our local planning process and the, subcommittees. So, coordination of services is a big piece of that subcommittee structure as well. Provider collaboration, information sharing, we routinely, provide opportunities for the providers to, share and collaborate regarding, what their initiatives are that they're undertaking. And then it also provides a venue for stakeholder problem solving, just sort of like whatever the issues are that our, provider community and our, recipient community are struggling with. It's a place where people are around the table, we can bring forth issues or problems that come up, put our heads together, or develop a work group or something to address issues. Okay, here, this is just describing the, composition of the subcommittees, and they do meet quarterly throughout the year. This slide is a listing of our contract agencies in Warren County and our 2016 contract amounts. So it's approximately $3.3 million in contracts for Warren County. I didn't provide handouts of this, but if anyone wants handouts, I can get those to you, or some copies of it. Can send it electronically too, I think. And there's a slide showing our, contracts in Washington County, a little bit less in Washington County. Over the last few years, we've had some opportunities for funding, from the Office of Mental Health that we have, requested could one county serve as the lead and all the funding flow through one county. It just made things a little bit administratively, easier. So that's why the amount in Washington County is a bit less, $2.2 million. This is just a graphic that shows you the amount of state aid versus, county tax levy, for Warren County, and then, similar graphic for Washington. The county funding that does, go to our agencies, this is just a breakout of which agencies that goes to. The other agencies are 100% state funded, but CWI, Liberty House, and the Association for Mental Health all receive, a portion of the county funding. Just a similar graphic there for, Washington County, same three agencies. One of the issues that I try to keep the committee advised of, throughout the year is, this is a separate line in the county budget, but, it's a line that we oversee and manage, and these are, criminal court costs are 100% county costs, and it's variable from year to year, as you can see, but in general we see a trend line that's going up, and so it's a bit concerning. These are individuals who we receive requests from the court for either for evaluations or we receive chargebacks from New York State when inmates who fail the 730 competency exams, so they're found to be not competent to stand trial. They go to a New York State hospital psychiatric facility to be restored. And so they go through a curriculum with them to try to restore their competency, their understanding of the criminal justice system, their understanding of their charges, and then they come back to stand trial. When that happens, we receive a chargeback from New York State for it's $400 and some a day that they're in the facility, and it usually takes 30 to 60 days for the restoration. So that adds up quickly. And we really have no control over how many defendants that'll be in any given year.
Do they normally go to Marcy? Is that where most of the...
Central New York, Marcy complex, yeah. And then the other item that you see on there are family court evaluations. Those are a smaller amount, but we also pay out of that line for requests from the family court for evaluations. Similar data for Washington County if you're interested, and you can see again the variability of it, and so it's hard to predict from year to year, but you also see sort of a general trend line that potentially looks like it's increasing there.
What happened in 2015?
Yeah, there was, again, that's what I'm saying, some years you can have nobody or one person who's in for a few days.
And that may be a big line, but in terms of the actual numbers, it could be a couple of people.
Yeah, it's usually a handful of people. And this is getting to be a little bit dated now. All of our agencies at one point were proud to have a presence on the web. Now they're looking at branching out, and most of them have a presence on social media as well, so you probably could find them if you were to search on Facebook or whatever the other, common social media are. But they all do have websites, so if anybody's interested, you can find them on the web. You can find more information about their services. I think this is the last slide. So a few additional responsibilities that we have are fiscal management and reporting. There's quite a bit of reporting that we have to do back to New York State related to the state pass-through dollars. We operate a single point of access process, and this is a referral process for high needs individuals. We have certain services like our residential services and our case management services where we have they're limited resources, so we want to target those resources to the people most in need, and when people no longer need that and they can be stepped down to a less intensive service, that's what the SPOA process does, is it looks at those scarce resources, who's in those slots, do they still need those services, how do we free up a slot for a new referral, and there's a series of regular meetings with our providers and our SPOA coordinator to facilitate that. We also oversee assisted outpatient treatment, and Amy Bartlett is very involved in that. She's been an attorney representing our department in most of those cases.
Clarify that.
This is a process where an individual, in general, the criteria for this are that there's some history of dangerousness, serious dangerousness related to noncompliance with treatment for somebody who's mentally ill. This came about, you may know it as Kendra's Law. A number of years ago, there was a woman by the name of Kendra Webdale who in New York City was pushed onto a subway track and killed by a subway train. And the individual pushing her prompted the Kendra's Law. So someone with a serious mental illness and has a history of dangerousness related to noncompliance can be court-ordered to comply with an outpatient treatment program. And so there's a structured process in place to do that. We have to have a physician that testifies in court, and there's a number of criteria. There's some clinically determined criteria beyond what I described. That it has to be at least restrictive, it has to be beneficial to the person, there's a few other clinically determined criteria that the physician has to testify to. Whenever there are certificate of need or requests to expand services, those requests come to us, to our community services board, usually goes through the subcommittees. You know, there's discussion about if one of our provider agencies is applying for a grant, et cetera. That's where that coordination issue comes in, so that we don't have multiple providers maybe going for the same grant funding or something like that. Just overall system coordination, we do get involved in emergency removals. These are police pickup orders from the community if someone's in immediate danger to themselves or others. They contact our office and we can order the police to have them removed to the hospital for evaluation. We also have 26 volunteers from the community who are clinicians that are trained in a extensive disaster mental health curriculum, and they're just like on a call list, and we're tied in with the county Office of Emergency Services, so that we're basically one of the tools in their toolbox. If there's an emergency, some sort of a disaster that they are responding to and they need a mental health response component to that, there is a team available that they can call out. And then Safe Act reporting, this is fairly recent. Anytime a clinician feels that someone is likely to engage in dangerous behavior, they're required to report that through the Safe Act, and those reports come to me for forwarding on to the Division of Criminal Justice Services. And then last bullet, I just wanted to highlight that we're involved in just a number of various healthcare planning structures. Overall, to improve the efficiency and effectiveness of the healthcare systems. And again, always welcome if anybody wants to come out, see any of the programs, come visit our offices. We're happy to host you, give a tour.
Was a ton of information, Rob. If you don't mind, can we get that emailed to us?
Sure. How best to do that? Because I mean, I did email.
Yeah, Amanda has that information. Supervisor Strauss?
Yeah, is that a, thank you, is that a 24/7 thing, Rob? Because you got the emergency removals, that can come anytime, right?
Well, the way the mental hygiene law allows me to designate physicians to do that as well, so I have all the psychiatrists at the hospital, Glens Falls Hospital, and all the emergency room physicians are designated to also be able to do those removals. So we do them during the day for individuals in the community. The hospital does them during the day for their patients. If they're known to them, somebody known to them, they'll still do their own pickups, but then they also do those after hours and weekends for us.
So does most of that come from law enforcement?
I would say most of it probably comes from law enforcement, but it doesn't have to. I mean, the mental hygiene law prescribes who can be a reporter. It has to be like a first-degree family member. It can be a physician who's treating the person, or a clinician. So they could have somebody who they're maybe working with in a session. The person leaves the session abruptly and they fear for their safety, maybe made a statement of going to harm themselves or something, then those people can all report and request a pickup order. Also includes law enforcement in that list.
Anything else for Rob? Supervisor Brock?
Would your office be willing to do mental health evaluations for future veterans?
Well, we can arrange for that.
Be here every day. Okay, hang in there, group. We still have, public health. Anything else for Rob? Okay, thank you, Rob.
Thank you.
No, public health is for, kind of like
Second, I want to particularly
Yeah, did you put that?
Me? I do that on purpose.
Remember last year with the crazy
I was talking
of
to
that
Matt
child?
Simpson, I know you're
Oh, yes, yes.
And there was some talk about going
Or
to
put it this
get
way, I can tell you.
a legislative change.
Yeah, that's it.
Oh,
That go anywhere?
I don't think you can.
you never know, logo.
I do look both ways before I trust.
Yes, we do. Thank you.
I remember digging through that law, and it does, I mean, it,
I guess Ron's not gonna
we
be here.
couldn't have any
He
other.
probably went back on EMC.
Yeah, yeah.
Is it worth it?
He's not coming back,
I bet you not.
We're sitting here pretending like we have the DSS, we don't.
Well, we saved the best for last, Pat.
And I'll try to reward you by being especially quick. If you want, what Matt, you were saying before that you wanted the people that travel to go, we can be last every month if
I
that's
think
good.
we're gonna keep it that way, Pat. That way, those that do travel can go first and get them out of here.
That's fine, as long as we can plan.
Yeah, yeah.
The planner's another
Yes.
part.
Yes, sorry about that.
That's okay, no problem. Okay, the first thing on our, agenda is to, I guess we already did you did the minutes already. We'd like to request a resolution to amend the contract with North Country Home Services. They're looking to have a rate increase, as you can see, from $26.52 an hour to $27.04 for home health aid services. And they were looking for it to be retroactive to January, but they didn't notify us, so I told them that, depending on what the committee says, it would have to be from now, and they were okay with it. We only have 2 patients with them, but it is a struggle for them, and every once in a while they serve people in the northern parts of the county, so we should, I think, allow them that.
Okay. Motion to get this on the floor made by Supervisor Simpson, second by Supervisor Bramer. Anybody have a problem with that?
So,
Go ahead.
so it's not retroactive, it's just starting upon board approval?
Yeah. So, yeah.
Okay.
Okay, all in favor?
Aye.
Opposed? Carried.
Moving on, we'd like to request a resolution to amend the contract with Shoreline Inc. to reflect an increase in the annual amount from $895 a year to $975. And, if you're in agreement to allow automatic renewals without coming back to visit you, as long as the rate doesn't change and as long as, it remains 100% grant funded. Hasn't been, raised since 2009, so I'm pretty confident we won't have to come every year.
Okay. Motion made by Supervisor McDonald, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, moving on to pending items and follow-up to last month's meeting regarding the issues we've been having with our 2013 Fiestas, and I believe our administrator's been working hard with us on this, and he can comment and bring everybody up to speed.
Good. Thank you. Yes, if you recall, just to bring everybody back up to speed on this, we have a number of Ford Fiestas in our health services fleet that have been giving us problems. Apparently, it seems to be the transmissions. And initially, the department was handling this on their own. They did not have, they weren't satisfied with the results. The nurses were still complaining of the cars. So we got our DPW manager involved, Dan Smith, who ran his own shop at one point before coming to Warren County, so he was able to test drive the cars. And he did a couple of things. One was to actually give us some specifics as to what he felt was wrong, so we could basically speak the same language as the mechanics down at the Ford dealership. And he also was looking at the cars from the perspective of making sure they were safe to drive. so that was the first step, because we needed to, we needed to verify what exactly was happening, and we needed to, in fairness, go down to the dealer first before we could do anything else. And I will say this, that one of the things that maybe came out of this, and I'm not sure how the last meeting was portrayed, but I can tell you that Robert Niemer in particular, contacted me and indicated that obviously this was a Ford issue with the transmissions, but he was very much concerned and would do anything that he could to assist us, and in point of fact, he has. The cars, what has happened is apparently a very limited number of parts available for this particular problem, and Robert was pursuing that with Ford. He told me he would speak to Ford about it, and he was able to get us, for our cars, 2 sets of those parts, which means we could fix immediately 2 cars. One has been fixed, one's going in the shop to get the second repair. In addition to that, a Ford representative, and I'm sure this happened because of Mr. Niemer's involvement, wrote me and said that I have been in constant contact with Robert Niemer, the service department, as well as Alan Perkins in the parts department regarding the Focus clutches for 4 of your vehicles. These parts are on national back order. I was at the store just last week, and the ETA was 10 weeks from the order date. Alan and I have been working very hard to expedite the parts, but there is nothing much more that we can do, as there are no clutches being delivered anywhere in the nation right now. Thank you for your patience and your loyalty to Ford Motor Company. I apologize again for the inconvenience, and this was signed by Geraldine Gaines, the Ford zone manager for the New York region. I think this is important because it shows me 2 things. It shows me that obviously Niemer is certainly doing everything they can for us. And by the way, I don't even know if we bought these cars from Niemer because we go on bid. He happens to be the Ford dealer that's servicing the cars, which is appropriate. But like I say, I got to stress again, they're really, I think, doing everything they can to deal with the problem. The Ford company, as I mentioned, we were lucky to get 2 of the sets of clutches right away, so 2 of our cars will be fixed. The other 2 will be fixed just as fast as we can. We'll continue to monitor the situation. If the ultimate plan is that if we're still not satisfied with the fix, we will go back to Ford again. Hopefully these fixes do take care of it, but if they don't, we'll go back to Ford. And then if that still doesn't resolve the problem, if you'll recall, we talked about having the county attorney look into lemon law rights and things of that nature, or perhaps trading the cars in ultimately. The bottom line is, though, is that we have indicated to the nurses, and I know Pat has, that we do not want anybody driving an unsafe car. We can take cars out of our fleet if we have to while we're getting through this. But in the meantime, I think it's also important to note that we're being, helped out by our local dealer. That's all I have to say.
Thank you.
And they are all the ones that are not fixed, are not being driven currently. We're, having fleet, people, if they're out sick or whatever, so it's a little bit logistical things going on, but it's worth it to make sure everybody is not put in any harm's way.
Vice Bramer, did you have a question?
Who's paying for the clutches and putting them back in?
This is all covered by warranty.
Okay, moving on to section 5, information for discussion, you'll see attached the emergency response report. Our new public health liaison is getting up to speed, and Angela Mead, who was in her position beforehand, this gal is equally as wordy as she is, so I think she's projecting that she's doing what she needs to do. But you may see a little bit of difference in the way she structures the report, but it is certainly, all the information is there. If anybody has any questions on that, we can move on to the status of referrals. And as you can see, we were down a bit in January, but we ebb and flow with that sort of thing. So it shows that it's important that we pay attention every month to see how things are going, and we'll continue to do that. I don't know, because maybe the winter has been not so icy, we haven't had as many broken hips, but they seem to be a little bit down for January compared. Moving on to an update of personnel issues. This is not the part of the meeting I was looking forward at all to today, but I guess it is what it is. The first thing is not a good thing. We do have a nursing supervisor out on very long-term medical leave. We are currently working, her colleagues are filling in, we're not looking to replace the position at this point in time. Everybody is pitching in and we'll see what happens. We may need to come back at some point in time, but for right now, she's concentrating on getting better. And we'll keep you apprised with that. The second thing is, kind of a bittersweet thing. Sharon has announced that she's going to be retiring, beginning in April after 32 years, so I guess she's allowed.
34 years.
Wasn't that long, I looked it up, it must have been before they kept personnel
It'll be-
charts.
True.
They had charts back then?
It'll be 34 years September 7th.
So it wasn't quite that long.
Right.
But anyway, so, she certainly is gonna be a loss to the agency, but we're gonna move on and, everything will be fine. Because, logistically, because it's a non-bargaining unit position, we need to do a salary study. And because Jackie's been out, she hasn't been able to really concentrate on that, although I have been in touch with her by email. And, hopefully we're gonna have more information, to be available at the Personnel Committee. So I guess probably, and Paul, correct me, we would need to just make a referral to the Personnel Committee from this committee. How would I do that?
Well, this committee needs to approve the filling of the vacancy, and then it would be referred to personnel to set that final salary.
We should do that now. Why don't we go ahead and do that now, so it stays in place? Motion made by Supervisor Simpson, seconded by Supervisor Frazier. All in favor?
Hold on, I'm, sorry, I'm not clear on what position is being vacated.
Okay, you haven't been here long enough, I'm sorry.
This is for the position that Sharon was leaving.
Right.
We're getting, okay.
Correct.
She's the Assistant Director of, Patient Service.
Got it.
And basically oversees all of the nursing, positions that work in the Certified Home Health Agency.
Okay, thanks.
Anybody that wants to visit our department, we'll be happy to give you a tour. So that'll be pictures will be worth 1,000 words. Okay, I'm moving on now to some, other news. We, were fortunate enough on February 2nd to receive an unannounced visit from the New York State Department of Health, who, have not visited us since, 2011. So they sent us, 2 new surveyors, who actually were very pleasant, certainly did a pretty thorough investigation, and I can't say enough about Janelle's ability to maintain wonderful policies and procedures. She likes to do all that stuff, and she's really good at it. So we, were told we were not getting any deficiencies, so that's a good thing, especially after not having been surveyed for that long period of time. But we have yet to see the written report. But, like I said, they've never told us we didn't have any and then, changed their mind. And I think had they gone back, they would have called and told us that, and that was a couple of weeks ago. So I think by the next meeting, we should maybe have a report to share. So
Those
that's,
would be no critical deficiencies or general deficiencies?
nothing.
Nothing,
They-
excellent.
And, with anything like that, I think we're wonderful, but, you're only as good as what they actually look at that day, so, but, I like to think that it's a really good indication that we really keep a very, tight ship and we keep an eye on those kind of things, and I think that's a good thing. So, moving on to the rabies program report, you see that was a pretty, I think, comprehensive report as far as what our 2015 looked like, and there's also, our 2016 rabies clinic schedule is posted on our website, and it's been sent out to all the towns and the City of Glens Falls and various other places where there may be high public traffic.
Patricia, some of these don't have any rabies report whatsoever. Is that because,
That was the last quarter,
okay,
and we do quarterly. In the annual report, you'll see for the whole year, but if you want us to send you the whole year, we can certainly do
no,
that.
I'm just wondering if some communities don't have rabies.
We don't, John.
Huh?
Which is good.
Oh, we don't either, but we check.
You never say never to any of it, and never is not a word we use in our vocabulary.
Yeah, all right.
Supervisor Bramer?
In that particular time period, they didn't.
Correct, yep.
Just for clarification.
Thank you, Chairman. This is a totally random question. Do we have a chart like this for Lyme?
Do we have a chart like this for lives? No, we don't. And Janelle can speak to that, but it wouldn't be an accurate chart.
We are now a Sentinel County because we've hit over a certain number of cases that are reportable. So we're only following up on 20%, so our technically reported to us number isn't characteristic of what's going on really in the community. We could get that information from the state health department. What was happening prior to us becoming a Sentinel County, we were getting the reports of Lyme. We were following up with the providers for information, and if we didn't receive that information back from the providers, then we were unable to report that to the state. And what you see kind of in the community is you have clinical data, and the doctor certainly can clinically diagnose the case, but unless that information is given to us, then we can spit it into like an epidemiological type report. That number isn't a value to the state health department that then compares that number to other places in the country through the CDC. So, in us becoming a Sentinel County and us focusing just on that 20%, we're able to do a better job with the follow-up with those providers, with those 20%. So we're not really getting every report that tests positive. The other thing that's associated with that is there's certain criteria to call something a case. It might be a positive lab that then is confirmed by another lab. So if both labs aren't done, that doesn't quite fit the description, so you're unable to kind of compare to, you know, where you are. So it is a reportable disease. The reports are given to us. We really don't have the data that we've got, like so many in Lake George versus Queensbury versus Athol or Thurman or Chester. We could probably get that information from the state health department, but as far as cases that we're actually following up with investigation, that's 20% of the actual cases that we get. And that has everything to do with us being a Sentinel County because we've met the threshold of cases.
It is a very hot issue, though. We get a lot of calls that are people that are not happy why I can't keep the ticks off the bike trails and things like that. And it sounds, I mean, really, people are very concerned, and we don't have a quick, easy...
Or complaints about doctors not being willing to diagnose it or that kind of thing?
I think they probably diagnose and treat, and when that happens, it makes the ability to get the actual test results.
And I think there's a lot of tests out there. When people get frustrated with what's going on in our regular community, they get frustrated and go to other so-called experts that really haven't gone through any evidence-based type training, but maybe anecdotal. And so then you get a lot of different tests that aren't FDA approved that they're using to call something Lyme disease, and then they're going through a lot of treatments that aren't necessarily evidence-based, that they're paying out of pocket for, that insurances aren't covering because they're not the protocols of what's recommended by the CDC and the state health department. Definitely a huge topic that needs a lot of attention, but the other thing is when you look at 67,000 residents of Warren County, you know, it's not really up there. I mean, things like chlamydia are way up there. That probably need more attention. And that's something that's kind of more communicable than something, you know, with ticks that's maybe somewhat preventable in trying to handle exposures to ticks.
Did you ask a question? Supervisor Brock.
The disease du jour, I guess you call it, is CPAP, and I see that all over here. Is that a big threat? I know if someone goes to, say, Brazil, comes back up with it, if another mosquito bites them, and, or, I mean, what's the danger?
We're very fortunate that for most people it's mild illness. I think the threat is right now we're suspecting that with pregnant women, there's a risk to the fetus.
Right.
So right now we're looking at pregnant women being kind of the most scariest of populations to protect it from. As far as in the United States, we have two of the kind of cousin mosquitoes. So it is potentially transmissible up here. Right now, New York State has had 11 cases. All of those have been travel related. In fact, most of the places in the United States that have cases so far have been travel related. And to be honest with you, we expect that because people are traveling. But what we're doing a lot of, and what a lot of those calls were for,
was number one, if somebody comes back, how do we go through the testing protocols and what sites are testing? I can tell you Glens Falls Hospital is not a testing site, because the specimen has to go down to -70 degrees and you have to transport on dry ice, and that's not something that the hospital is capable of doing. The Albany Med, we've already had one person tested, where we were able to send them to Albany Med, and that system works very well. It's not a urgent thing, so that works pretty well. We don't really at this time have to worry about person to person. There's some concern of sexual transmission. With the sexual transmission, there's recommendations in place for people that have traveled not to have sex with pregnant women, or for someone trying to get pregnant within a certain amount of days of their travel.
We've listened to a lot of webinars and a lot of conference calls, and I would anticipate that that's going to be continuing for a while, and that's good, and we've got a whole new infrastructure lined up down at the State Health Department, so I think we're in good hands in that respect. But it is interesting when we get the new diseases du jour that we're ready to hop right on it. So,
And what is a Sentinel County again?
Sentinel just means, one, that we've met a minimum threshold of cases, and I can't really tell you how many that is, but it just means that now we only have to do a sample of the population of positives versus all the positives in regard to following up.
So that is 20% of the cases
That are positive, yeah.
Okay.
So like the labs have an electronic process of reporting positive cases to us on certain communicable diseases. So when the Lyme ones come into this database, only 20% get reported to us for follow-up. The other 80 go into the... Right. And in addition to those, if a doctor was to call us up and say, you know, I have Janelle Jones is diagnosed with Lyme disease, I've clinically diagnosed her, we would follow up on our physician-reported cases anyway. This is just the generated lab reports that we get.
Okay.
One other quick thing that our fiscal manager responded to is we have an Ebola grant, for those of you that have been on our committee for a while. And, you know, with the good news of the lack of activity in the Ebola area, we are able to focus some of that money on Zika response and planning and follow-up. But again, Zika is not really person-to-person, fortunately, so we are able to at least utilize staff time to kind of, you know, we're going to have to do certain deliverables with the state and Zika virus, and we can compensate that time through this Ebola grant. We got special permission.
Financials.
Okay, attachment number 2 are the financials for 2015. I just wanted to give you as updated as it is. The books are not closed. We do have a lot still to do. Didn't change much from last month when I presented 2015. We did close our December books for our MCH and our long-term care program, so all those revenues are in there. I've accrued those. They were $227,745. Our salaries are still the same as last, because they did book some adjustments, but bottom line is our salaries for 2015 were 95.75% of what was budgeted, and that's because of some of our positions in the CHA, some nursing positions that were not fully filled. And attachment 2A is our comparison again with I did final 2014 to where we are right now, current 2015. And one thing just to bring again to your attention is we still are waiting for our WIC food vouchers. You know, they give food vouchers to everyone who comes into WIC. At the end of the year, we have to get the value of all those and book those. We won't get those values till April. So once we get those, we book those with the treasurer's office. And the same with our preschool program. We can bill for all of those expenses that we've already taken care of. And again, probably late March, early April again is when those numbers will be done, and we'll be giving those. So that will reflect in our revenues at that point. Attachment number 3, I did give you where we are currently right now. I know it's not a lot, but it is something to look at for 2016. You'll see regarding salaries that we are right now at 9.77% of budget, and this time last year we were at 10.68% of the budget. Revenues don't reflect yet January's, we just closed December, so we're working on closing January's revenues within the next week or so. And again, attachment 3A is the comparison, again, last year in 2015 to current. And, you can see again with the salaries, like I said, are about 20,000 less right now than they were last year at this time. Again, that's due to a lot of the positions that, were not filled. Same with the fringe benefits. They're down because of that same reason. Contractual is down primarily because of, again, timing of when invoices are getting in as of, for 2016 and 2015, trying to get the 15 closed first. And revenues, you can see, weren't very much different last year compared to each other again, because we're at year end, we're trying to get that, and so obviously last year and this year we don't have January revenues reflected there yet. So next month I will probably just present to you all of 2016 to keep you updated with the current information.
Any questions?
Nobody has any more questions or any questions? That's all we have for you.
Need a motion to adjourn. Made by Supervisor Strauss, seconded by Supervisor Bramer.
I have something.
We are adjourned.
Okay, still wanna, point out to the committee that this morning in county facilities, we talked about an advisory group for the county, DSS, Wheat House, what else? Code Blue.
Thank you. Okay, everybody have a great afternoon.
What's left of it?